Hi everybody, today I'm going to talk about Ivacafor in a g551d homozygotes with cystic fibrosis. First, we're going to talk about the definition. Cystic fibrosis is the most common life-threatening autosomal recessive genetic disorder in whites. It's characterized by a thick viscous mucus that accumulates in the lungs, digestive tract, and other parts of the body, leading to complications such as recurrent lung infection and pancreatic insufficiency. Ivacafor potentiates the open channel probability of the g551d cystic fibrosis transmembrane conductance regulator CFTR protein. Now we have a video.
In lung airways and passages in other organs, cell surfaces have tiny proteins called CFTR. These act as channels for chloride ions to regulate the movement of salt and water in and out of cells. In cystic fibrosis, this process is disrupted because of a mutation or error in the CFTR gene, which provides the instructions for making CFTR protein channels. As a result, thick, sticky mucus builds up in many organs. Some CFTR mutations can cause what's called a gating defect, where the CFTR protein channels are present at the cell surface, but fail to open correctly. Kaleido is designed to keep CFTR protein channels at the cell surface open longer, to improve the transport of salt and water across the cell membrane. Indication and important safety information. Kaleido is a prescription medicine used for the treatment of cystic fibrosis, or CF, in patients aged 6 years and older who have a certain mutation in their CF gene called the g551d mutation. Kaleido is not for use in people with CF due to other mutations in the CF gene. It is not effective in CF patients with 2 copies of the F508del mutation in the CF gene. It is not known if Kaleido is safe and effective in children under 6 years of age. Kaleido should not be used with certain medicines, including the antibiotics rifampin and rifabutin, seizure medications phenobarbital, carbamazepine, or phenytoin, and the herbal supplement St. John's wort. Kaleido can cause serious side effects. High liver enzymes in the blood have occurred in patients taking Kaleido. Regular assessment is recommended. The most common side effects associated with Kaleido include headache, upper respiratory tract infection or common cold, including sore throat, nasal or sinus congestion, and runny nose, stomach or abdominal pain, diarrhea, rash, nausea, and dizziness. These are not all the possible side effects of Kaleido. Patients should tell their healthcare providers about any side effect that bothers them or doesn't go away. Please see full prescribing information for Kaleido at www.kaleido.com.
Well, now we have the applications in medicine. The hallmark is a classic triad of symptoms, most often from infancy or childhood, that associate progressive obstructive lung disease with sputum infected by Staphylococcus aureus or Pseudomonas aeruginosa, exocrine pancreatic insufficiency, and a high sweat chloride level. The pros. Ivacafor is a CFTR potentiator approved for the treatment of CF patients. Ivacafor offers an effective and well-tolerated treatment for the clinical management of CF patients with the g551d mutation. The cons are autosomal recessive lethal disease. It is a life-limiting multisystem disorder that affects the chloride transport system in exocrine tissues. Thank you very much.